Hey guys, welcome to one of Flinny's Wednesday workshops again. Today we're going to talk about patient observations. Now out in the middle of nowhere you're not going to have all those tools of blood pressure cuff and stat probe and BSL kits. But what you need to do is just to take some simple steps in observing your patient at all times. I've got lovely Libby here today who's going to help me go through the motions. But what I want you to remember throughout the next coming session, if we want our patient to be warm, our wet, pink and sweet. And that comes from simply when babies are born. I'm going to use that the whole time. Warm. We want to keep our patient warm. Now you remember we're going to be in a canyon environment or out in the middle of nowhere. So I'm going to rehash on hypothermia again someday. Get your patient warm. You want your patient wet. What does that mean? Well, yeah, they're going to be wet in the canyon. Let's put it into perspective. You want them hydrated. Okay, you don't have to flood them with water as they're lying down trying to get warm. Keep them hydrated. Don't let them run too dry. Common sense. Pink. Well, pink, warm and wet kind of go together. So keep them pink. I mean, if they're pink around the face, they're going to be perfused. So that's just one to put in there. Sweet. Well, what does that mean? Provide some food. Provide a little bit of food every now and then. It doesn't have to be all the time. You don't have to fill them up on sweets and chocolate and food for the 24 hours that you're out there. But give them a little bit of food every now and then to keep their levels of glucose in their body up. What I'm just going to do with Libby now is simply just show you some basic observation on how to monitor your patient without all those fancy tools. So remember, warm, wet, pink and sweet. Okay? Think of a newborn baby, what all the things you need in that. Okay? So Libby, our newborn baby over here, we want to check her pulse. Now we always say, we check her radial pulse. So if you can all find radial pulse, the radial pulse starts here, okay? And up here we start our brachial pulse. Now by just simply me measuring or feeling Libby's pulse, is it strong, is it weak, or is it fast, or is it slow, or is it normal? We can count that. Now a simple way you can count that is I'm going to count Libby's pulse for about 15 seconds. So roughly about 15 seconds you're going to count. Once you get the 15 seconds, let's say I've counted 15 beats. You're going to time that by 4. That will give you how many beats in a minute. Okay? Common sense mathematics. So that would be 60 beats per minute. That's pretty good average heart rate for a young lady like Libby. Her heart rate's going to be anywhere while she's resting, hopefully uninjured, anywhere between 60, that's quite fit, to about 80. Now if it's faster or slower than that, then you really need to question. If it's like 40 beats a minute, you want to know if Libby's a super natural athlete. She could be, who knows. Or there's something else going behind the scenes. If it's super fast, what's going on? Has she been traumatised or her body's reacting to something? So that's a good way to measure. Also, the other thing is, if you can feel her radial pulse, you're guaranteed you'll have a blood pressure of roughly 90 and above. If you know about blood pressure, you'll understand what I'm saying. If you can feel her radial pulse, which is quite nice and strong now, her blood pressure will be roughly 90 and above. If you can't feel that pulse, expect her blood pressure to be low. If you can only feel her brachial pulse, then her blood pressure is going to be below 90, probably somewhere between 70 and 80. Okay? And if you can't feel either of those, then we're in trouble. Okay? You can only feel her carotid pulse on her neck. Yeah, you need to start thinking about what's going on. Has she been traumatised? Is she bleeding? Has she got other things going on? So that gives you a rough idea about measuring pulse rate, and that will give you a simple guide, a very basic guide about blood pressure. The other thing you want to watch out for is a rest rate. Rest rate, heart rate and blood pressure all kind of combined together. They'll give you a little clinical picture of what's going on. Now if we've got Libby here lying down wrapped up in a blanket or whatever, a good way to measure it is watch the chest rise and fall. Same as the heart rate. Now if you can't see a chest rise, well, you don't mind if I put my hand there? Put my hand on top of her chest, and I'll be being respectful to Libby. Count how many breaths up and down. So one full up and down over 15 seconds again. Then times it by 4, they give you how many rests per minute. Now an average person should rest between 16 to 20 breaths per minute. That's an average healthy person. If it's above that or way below that 16 breaths per minute, then be concerned. There's something going on in combination with heart rate and blood pressure. Keeping patient warm. Now you're not going to stick your finger in Libby's ear and maybe able to measure her temperature out in the middle of nowhere. It's not going to work. The only way you're going to know that patient's warm is by asking them. Are you warm, Libby?
Yes, I am.
Fantastic. Really the only way you're going to measure a temperature in the wilderness. But once you've wrapped that patient up, given them some food, some water, made them dry and warm, then that's how you're going to measure temperature. So guys, that's some very basic patient observations. Okay? Be safe out there. Catch you next time.